back again for our fourth episode of Unscripted with Nurse Besties. Hey, everyone.
Hey, hey.
Happy New Year. It is 2025,
Yes.
and I am one of your hosts. I am Calm Couture Wellness, Nurse Calm Couture. Well, hold on. MP Calm Couture Wellness,
Yes.
and my beautiful co host, Jessica Renee.
Hey, everybody, and Happy New Year. We
So
made it, girl.
yes, yeah, listen, yes we did.
Yeah.
We started our baby in the fall of 2024, and
Yes.
so now we are in 2025 going strong. So thank you all to our supporters, those of you that watch us, that share our videos. We are truly uh thankful for
Yes.
you all. So
Yes, absolutely.
so continue to share, continue to get the message out there. Like I said, we are here to give information, keep you on top of information, and just also, like Jessica Renee said in our first ever episode, this is your safe space.
Absolutely. Absolutely. And if you are new and joining us, welcome to Unscripted with Nurse Besties, where we just share our goals, our what's going on in nursing, keeping, like you said, keeping updated, different topics that just go with Black women in the workplace, specifically in the healthcare field. And again, if you're new here, go on over and watch some of our old videos as well. Run those numbers.
Make sure you subscribe.
Yes,
Yes, we want you to
subscribe.
send those videos out. We want you to watch it, but definitely hit that subscribe button,
Yes,
okay? So you
yes,
can stay on top of when those new videos drop and all that good stuff.
absolutely.
So what are we talking about today, Jessica Renee? What are we getting into for
Well,
2025?
it is 2025, of course. New year,
Yes.
new nurse. You know how they
I
say,
like
new
that. I
year,
like
new
that.
me.
Switch it
And
up a
we
little
do this.
bit.
Yeah, new year, new me. So, new year, new nurse.
Yeah.
And yeah, we're going to talk about, I guess, just 2025 goals, maybe some personal goals, some general goals. Yeah, I guess just kind of what 2025 will look like.
Okay.
Yeah.
Awesome.
And resolutions. Do you set resolutions? Are you a resolution person?
So I used to set resolutions and all that good stuff, and I'd be like, oh, but a lot of times I didn't stick to them. And
But
so I really set resolutions more so towards like, I'm gonna be honest, towards weight. You know what I mean?
I think we all do. I've been losing the same
Or I'm
100 pounds for the last, since I gained them.
hey, like I would be like, oh, I'm gonna lose this or whatever, and or I'm gonna, go dry, so dry January or whatnot.
Oh, I never said that. I've never done that. You lost me
Well,
there.
well,
Never.
I did try. I did
Okay.
try.
I've never even
But
attempted.
I in 1 year I did. It was what full what I think 2 months, 2 3 months I did. I went dry.
Okay.
Um, but as far as like professional wise, I think a lot of times we be so honed in. I know for me, I be so like focused on other things or focused on what I'm currently doing for my current uh role or opportunity that I'm currently in at
Hmm.
that moment. I don't always get to sit back and say, what are my goals for career wise
Right.
for this year? And
Hmm.
I think that's something that myself, because I'm like I said, I'm bad at it, but I really think that's something we should start doing.
Hmm. I agree. I agree. Unless like I was in school or something like that, I never really set a career goal
Right.
outside of when to get out of the that current job.
Right.
That was it. It was usually like I'll
Ditto.
stay so many years and then by this time I want to leave and then kind of figure out what the next step is. But yeah, never really planned out the career or like just goals within that time frame.
Okay.
Yeah.
Yeah, I've always it's always been like once we hit that January, that new year or
Hmm.
whatnot, it's always it was always something related to, like I said, the current position that I was in.
Right.
Either we had a deadline to meet because it was the new year, reports that were due again because it was at the new year. So it was like I never was having the opportunity to just really focus on where am I going, what am I doing,
Hmm.
or for me in my career moving
Right.
forward, or unless I have like having a conversation with like my leadership, and they may ask me like, oh, well, what's your goal for this year? But it's
Hmm.
more so related towards the organization. What's your goal
Hmm.
in regards to the organization? What you're gonna do, I guess, to not guess, but what are you
Right.
gonna do in regards to improve yourself
Growth
to be
there.
more of a asset right at
To
that
the, yep.
organization?
Yeah. Didn't care nothing about those, honestly. This is, I mean, I'm gonna be for real. But in my career, it's only been a few places that I really like. Now, this one, my new current one, I will have like I actually really like it. So I will be a little bit more in tune and like take that stuff seriously. If I don't really, I could care less about growing this company. Just have my money when it's time to.
And sometimes, you know what, it be like that because it's like some places are just that, like placeholders,
Yeah.
or you come, or it's like they treat you so bad that you come to the point where, you know what, I'm just here to get a paycheck.
Hmm.
I'm gonna do what I need to do,
Right.
but just make sure my money is deposited on time
Make sure I
at
have
the
my money.
date. Right.
I'm going to take care of my people because, we are nursing. So I'm going to take care of what I have to take
That's
care of.
right.
But anything outside of those two things,
That's it.
yeah, that's it. That's it. So I'm excited this year to actually be starting my year in a role that I actually enjoy. It's been a long time since I've been in a position that I've actually enjoyed and, then kind of thinking future wise, like where to go career wise.
Nice, nice.
So I'm excited. I'm not a resolution girly anymore. I used to set personal resolutions and everything as well, like personal goals, which, like you said, you write them down and like, because I look back at like maybe 2 or 3 years ago, I still am working on some of those goals. But also, it's like I'm gonna give myself grace. So I think no, 2 years ago, 2 years ago, I stopped doing goals and I started picking a word for the year. So around October, November, I'll start thinking about like, what do I want? Like, what is the theme of
Right.
that year? So it was like one year was joy. Last year it was freedom. This year is like transformation and
I like that.
stuff like that. So everything kind of anything that I do through that year, that theme is at the top of it. And I actually have
Awesome.
really enjoyed that. I've really enjoyed doing my goals and things like that way.
You know what? I like that because it's like you focus less on the stressors of trying to meet that goal and
Yeah.
focus more on what that particular thing means to you. And you
Hmm.
go towards the things that gravitate, or, like I said, what it means to you in regards to, like you said, freedom was one of the themes.
Right.
So you gravitated or you did things that made you feel like you had that freedom. You know what I
Right.
mean?
Right.
Um, so I like that. I like that.
Yeah.
I'd rather have a theme versus
Yes.
a goal because I feel like sometimes when you don't reach that goal in regards, and this just an example,
Hmm.
weight.
Hmm.
I would feel so bad when I didn't reach my goal or if I went up in weight
Yep.
and it was like, okay, I give up and I never reached my
Got back
goal
to
at
it.
all that for that year. You know what I mean?
Hmm.
And so I think sometimes just having goals, and I know they have this thing now called SMART goals, and
Hmm.
make them specific, make them measurable, and all of
Right.
that
All
good
that
stuff.
crap.
Um, but I just think like having a goal in general, and then
Hmm.
it's nothing wrong. Don't get me wrong. It's nothing wrong
Right.
with
Goals are
having
good.
goals. Goals are good.
Right.
But you do want to make them measurable. You want to make them, you do want to use that smart analogy where you make them specific, make them measurable, make sure you
Right.
can actually reach them, and
Hmm.
put a time frame on it
Right.
as well. I think that's the most important part. I think
Hmm.
we set resolutions or set goals, and we be like, all right, I got all year to do this.
Right.
And then and
And
then
for
here you
real,
go at the end of December, December 31st,
you're
at the
like,
end of that
what?
year, and you be like, I ain't did a darn thing.
Right. It is a thing called like, and surprisingly, I haven't seen much of it this year, but last year was a big thing where it was like a 3 month year. I can't remember
Okay.
the exact title, but basically you would plan your goals out for a quarter. And
I was
so,
just about to
and
say do it per quarter instead
yeah,
of like trying to have it for the whole year. If you
yeah.
do it, and I like that idea.
Hmm.
If you
Cause
do it
it's
per
like,
quarter,
I got to
it's
get this
more,
done by
yep,
April, the
it's holding
latest.
you accountable, you know what I
Yes.
mean?
Yes.
Versus having that long span, like, oh, I can kick the can down the road. I'll
Hmm.
get it. I'll do it. And
Yeah.
then, like I said, December 31st, 2025 or 2024 roll around, and you
And
still
you're like,
hadn't reached
oh,
what reached those goals. You can't check nothing off that board off that vision
right.
board or whatever you created.
Yep. Yep. And I did do that. I tried to do it like break it down in quarters last year, and it did help. Like it kept me
Hmm.
kind of focused. I fell off. I think everybody kind of falls off around like May, June,
Yeah, yeah,
that May, June area. But
yeah.
again, like I said, I kind of come up with my word at the end of the year, and I do reflect. Like November, December, I'll go back and reflect, and I still, even though I wasn't as disciplined as I was in the beginning of the year, it
Mhm.
still helped me. Like I was more mindful, I should say, of the things that I wanted to work on last year, like the ones that I started in January and was very aggressive with. I still kind of kept some momentum through the
And
year with those goals. So yeah, I think you just have to find what works for you, and
absolutely.
also like give yourself grace in this too as well. Like we as Black women just don't give ourselves enough grace.
You
The
can
goal
say that
might not.
again. We are our own worst critics for
Yeah,
sure.
yeah. So we may go hard and have a list of things to do, and we gotta wire in some space. Like the goal may not be reached this year. Doesn't mean that it's not attainable, or that because you didn't reach it in this certain time frame that you can't continue on. Like you said earlier, we're hard on ourselves,
Right.
and so we definitely have to give more grace, because eventually those things are going to get knocked off, or you're going to want something different,
And
and
that's
that's
so,
okay too.
yep. And it's okay. Like you said, that's fine. It's okay to, and I think we also need to remember, call out, just because you have goals or you have a theme and say you accomplish something that may not necessarily be on your goal list, add it
Hmm.
to it.
Absolutely.
Add it to it, especially if it's a major like opportunity or accomplishment,
Hmm.
something maybe you weren't at least expecting. Um, that
Yep.
put it on your list. That was an accomplishment and
Hmm.
check it off.
Yep. I was
You
just
know
going
what
to
I
say, add
mean?
it to it and cross it off to show
Yep.
that you are making progress. We're always making progress every day that we're doing something, whether it's to benefit our families, ourselves, just the opportunity of having another day. We're progressing, and we don't take enough time to
Absolutely.
be grateful for the little things. Literally, all of it counts.
Yes, it does. It does. So, what are some, one that comes to mind, a goal, career advancement, always a good one to have.
Hmm.
Like I said, you know, when I was with an organization, it was always what was I doing to better or help grow that organization, right?
Right.
So when we say career advancement, what is your goal for you? Not to necessarily, now, don't get me wrong, if you love where you are, then great.
Right.
Then go ahead, rock out, plan out what your career advancement will be within that organization.
Hmm.
But just know you got opportunities. Um, you know, you a nurse. So
Absolutely.
you're a nurse, whether you're an MP, you got plenty of opportunities. So you don't have to just stay
Hmm.
right there. You can branch out. Your career advancement should be what it is that you want it to be, whether it's
Hmm.
in-house or external.
Yes, absolutely. I agree with that wholeheartedly. And really getting into a place that you love. At some point in the career, we want to climb the ladder. We want to, because that's what we're told to do. And as Black women, that's just what we're wired to do. We're always doing something.
Yeah.
But it's always, it's also good to find your area. That could be, you may not want to go back to school. You may not, necessarily want to do, I don't know, an MP, doctorate, whatever. But find your area that will make you happy.
Yes.
We spend a lot of time at work, and it definitely makes a difference when you're in a area and in a field that you don't necessarily enjoy. So that could be a goal, is to find out what it is that you like.
Oh, that I like that. Yeah, what specialty, what niche you wanna go into.
Hmm.
And I mean, once you get there, if you find that you don't like it,
You can go.
go you can leave. No one's
You
holding you
absolutely can
there.
leave. You
You can
absolutely can leave.
absolutely leave, and
Hmm.
don't think someone is holding you there, because that definitely is not the case.
Hmm.
But that is, I like that. I like
Yeah.
that because a lot of times we get into certain specialties and we may feel stuck, or we may, like you
Hmm.
said, feel like we spend a lot. There was a study done, um, and I have to find it, but this was years ago. I read it for a paper that I wrote, and
Hmm.
they said people spend more time with their coworkers than they do with their families. So
Absolutely.
you absolutely need to make sure you somewhere that's where you happy,
Hmm.
because
Hmm.
you're spending more time with the folks at work than with
Right.
your family.
Right. We should have fun. We should be able to work with each other. Just have a good rapport. And if you
Yeah.
don't have that, absolutely find something. That is one of the main things that I look for when I'm in a job. Like, am I going to
Yes.
be able? Am I going to
Yes.
feel safe amongst my coworkers? Now, leadership, management, all of that stuff. You know how that goes. But my
Mhm.
people that I'm working directly with,
With
like, we need to be. It needs to be a good environment.
Yeah, it needs to be a cohesive environment. You need to be able to lean on one another,
Hmm.
because they will be your people when something happens. I can kind of think back to when I was working at a clinic, um, and they're in Delaware, and you know, we had someone that lost a family member,
Hmm.
and we pulled together. We were like her, basically, like we said, we like her family because
Right.
we was there every step of the way with her. We gave resources. We gave financial resources.
Hmm.
We pulled together so much for this
And that's really nice.
particular person.
Right.
And that's what you want to look for. When
Hmm.
something happens, you want somebody being like, "Oh well." I remember I had said something at a another place where I worked,
Hmm.
and I was like, "Oh, this person, they lost a family member." I was like, "We should get a card." And they looked at me like with a glazed over look, like they could care less.
Right.
I was
And that's
like,
sad.
"Oh, that's what type of time we on?" And so you want to be You want to be somewhere where when something happens, people have genuine concern for you. People are pulling
Hmm.
together. We were literally going by the hospital for this particular
Hmm.
person and making sure they were okay, bringing stuff,
Right.
not just her family. I mean, it was definitely, we pulled together, and it was close
Right.
knit. It was a family. So like
Hmm.
you said, you want to make sure you spending more time with them. You want to make
Hmm.
sure that it's a cohesive environment, because when you are in a tumultuous, I don't want to say make it sound that bad, but when you are
But it
not,
is.
it can, what, you're right, it can be a tumultuous
Yeah.
situation,
Yeah.
and that can really have an effect on your mental health.
Hmm.
It really
Hmm.
can, and it'll have you, having knots in your stomach going to work, having
Hmm.
anxiety or panic attacks.
Hmm.
outside in the car, or
Yep.
every time you wake up, you're dreading going in, you have impending doom, you
Mm-hmm.
driving into work and just like, so listen,
Yeah.
if you are experiencing all of that, that is not the place for you. It's time to
Correct.
just find someplace else.
Mm-hmm. Yes. Absolutely. Find someplace else, and there's money out there.
Yeah,
Because a lot of us will stay in situations because you think it's not going to be a good financial move. And I know, we have other things that we have to think about, but it's money out there. The longer you're at one place or whatever, you're still gaining your experience. The years are still going by of you being a nurse, RN, LPN, NP, whatever your title is.
right.
You always you can go out there and get other money. I know that was
Absolutely.
a fear for me in moving certain jobs and different things like that. I was like, I don't know, no, it's out there. When I finally got out and was able to transition, I was like, oh yeah, it's really
Yeah.
out.
Yeah, listen, it is out there. They're trying to keep up with the market, you know what I
Right.
mean? They're trying to, keep up with everyone else in the job market. So
Mm-hmm.
the dollars gotta make sense. So
Mm-hmm.
they find like, okay, this person is paying this. We gotta come comparable to what everyone else is paying.
Mm-hmm. Yep. Yep.
So I think the only places that don't necessarily, I think even state jobs have even come up just a little bit to be more comparable because
They might be.
no one wants to, it's hard to, at
Yeah.
first they used to sell you like on the benefits, but
Mm-hmm.
people gotta live, people gotta make
Right.
enough to pay their bills.
Mm-hmm.
So I think even, when you have state jobs increasing the pay, that says a lot. So the
Right.
money is out there.
Right, right. And sometimes you gotta take, especially if you're early in your career,
Hmm.
sometimes you can take those, whatever type of jobs a little bit lower just to get your experience. And
Absolutely.
then, go ahead and move on. So
I agree. Been
it's
there.
it's, it's different, plenty of routes to go.
Yep.
And I think at the end of each route should be your happiness and your mental health,
All the time. Always choose you. Always
regardless of
pick you
what you
first.
do.
Always pick you first. Yeah.
Always. Absolutely. Absolutely.
What else you got, Jess?
Let's see. I don't know. We talked about career goals. What does your 2025 look like?
Oh, my 2025. So, oh, it's so much. Okay, so where do I start, right?
Right.
So, like, you're 2025 and I'm gonna I want this to be relatable. So, like
Yes.
if you are trying to get certifications, that can be a smart goal.
Mm-hmm.
How long you plan to study, how long you plan to when you plan to take the test, and what type of studying tool material you plan to help you uh throughout that course of time that you're studying before you go and take that test for certification.
Mm-hmm.
Certifications can be, again, in regards to specialty, there's certifications for case management, there's certifications for
Right.
cardiac. There's so many different certifications for nursing and different
Mm-hmm.
specialty areas, as well as, of course, we all know if you go into advanced to be an advanced practice
Right.
nurse, you gotta do, especially if you plan on being like in a clinical setting. So you got to do one if you're going to go into family nurse practitioner, you got to do a cert for that.
Mm-hmm.
Psychs, you got to do a certification. Women's health nurse practitioner certification. Acute
Mm-hmm.
care NPA certification. So I can go on and on.
Right.
But also, I believe there is a certification if want to go into being a nurse executive. So those future CNOs,
Mm-hmm.
uh, chief nursing officers,
Yep.
there's a certification for you. So there's, just make your goal, make it smart. Don't take too much time because
Right.
then you run into like that test anxiety and you're overthinking stuff and now you done let like 3 months go by and now you're
Right.
trying to
Yeah.
you try to take this test and you like, so Don't do that, but make sure, at least give yourself like maybe 6 weeks to study. And then after that 6 weeks, make sure you're taking it in that seventh week or whatnot.
Mm-hmm.
That's just my spill. If you are a nursing content creator,
Mm-hmm.
smart goals. Um, what do you plan on? How do you plan on increasing your viewership? How do you plan on getting more subscribers or more followers? Whatever the case, whatever platform you're on, are you plan on attending like any podcasts? Like Jess Renee and I plan on
Mm-hmm.
attending some podcast festivals. So
Right.
hey, look out for that content. We'll be posting that.
Yeah.
So, what are your plans? And it's good to like sit down, map that out,
Yes.
not just with your plans if you're a content creator, but your plans in general for the year.
Mm-hmm.
It's good to try to map it out for the 12 months. And like Jessica Renee stated, using that quarters. I like
Yes.
me personally, I fell in love with using the quarterly system just from working in leadership. I found it easy to track like things in regards for
Right.
reporting, and just kind of going from there in regards to when you're doing financials and all that stuff that
Mm-hmm.
gets you have to be responsible for. So I like quarterly, doing the quarterly goals. It makes more sense. It keeps you accountable.
Right.
That word accountable, um,
Yes.
it keeps you accountable. So
Mm-hmm.
I like the quarterly, and you think about it, it's only 3 months.
Right. Right. And you can get a
So
lot done in those 3 months if you really,
absolutely.
are in a space to really lock in and knock some stuff out.
Absolutely.
Yeah.
And so, just doing, those are some of the goals, and, you know, that's what I have planned. That's my plan.
Yeah.
Just doing that, and hey, getting back in the workforce, and going from there.
Yes. Yes. I love it. I love it. Good. Good.
So, what else we got? What else we got? I think we covered what the professional development. If they
Yes.
that kind of goes hand in hand like with certifications, but professional
Hmm.
development, if you are in a state where you have to turn in continuing education credits.
Right.
So this is important. We
Yes.
all get our renewal like in the odd. I think
Hmm.
Delaware
This
gets
year.
theirs in the odd, yeah.
Yep. Yep.
So
I think what
it
twice? I know mine is like September, but isn't it? I think it's one in like May or some April, May. So or
yeah,
some
it all
earlier in the
depends.
year, and
Mine
then.
mine is in September.
Hmm.
Here is January. So
Okay.
um yeah.
So yeah, you just
So
gotta keep up with.
yeah. So like you definitely gotta I have to keep up with too. So it's it helps that they're both in that
Yeah.
in that odd year.
Hmm.
So that's helpful. But you have to Delaware wasn't as strict in
Hmm.
regards to getting those continuing educations
Yes.
completed and sending them over. In this case, definitely had to make sure that I was on top of that, getting
Right.
those over, and um, doing what I needed to do to make sure that
Yeah.
those required, some places require 40 continuing education hours. Some, each state is different,
Hmm.
unfortunately. There's no blanket thing.
Right.
That which would be nice if there was just a blanket, across like,
Hmm.
hey, nurses all over the US, we require like, 80 continuing education hours or 40,
Right.
whatever the case may be.
And
And
some don't even require it at all.
yeah,
They can
yeah,
just renew.
yep, yep. So that's making sure you map that out when you plan on having that completed,
Hmm.
before it's time to. And if you are due in September, and you are in a state where you got to have it,
Yeah.
make sure you go ahead and get that done. You
Yeah. Go
you
ahead
do
and get it.
not want to
I'm
be
surprised every other year.
2 weeks before trying to get 40 hours of continuing
Yeah.
education credits done. So
Yeah.
you can make sure you can so you'll be able to renew your license. It don't matter if you got the money to renew. If they want them continuing education credits,
Yeah.
and then
Absolutely.
you better have it sit there. Oh my gosh, that's more
Absolutely.
so for our new grads. If y'all
Yes.
if
And
you're
luckily
not
through school
sure,
they walk you through that, you know, for at
yeah,
least for your first one. So you'll have the, the understanding. Just remember that first go around. I think that was the one that everybody was nervous about, especially when you come out of school. You're like, wait. Now it's like, so they went up, they went up on that your license. I gotta pay to do this.
yeah, yeah. Listen, this
And
is
it's
not.
not it's not a little it's I mean, it's a nice amount. It's a
It's
bill.
a nice chunk of money, and if
Yeah,
you
yeah. It's
in
a
two
you can pay a
different,
bill with it. So yeah.
and if you in a state that's not a compact, that's not a part of that
Yeah.
compact, you got to pay twice.
Yeah. Yeah.
You got to
Every
pay
year I'm
twice.
like, oh yeah, I should get my compact license. Every year I say it. I don't know why I don't have any desire to really do it. In my mind, I'd be like, oh yeah, if I
It's
get it, I can go
nice,
up to like Philly or something like that. But in reality,
but
I
not every
probably won't do
state
it.
is in it.
Right.
Unfortunately, I forget the number, but it's a good amount in there. So,
Hmm.
like, if you plan on kind of going, I think like I believe there's a lot of states in the Midwest,
Yeah.
on the East Coast,
Hmm.
um,
I say it
so
every year. I'll be like, oh yeah, I should do that every year. I don't
yeah, you'd
know.
be like, oh, I should definitely do this, but then oh, I
Right.
ain't
What
worried
was the
about
reason
it.
behind it? I guess just
I'm not
because,
going to the Midwest to work.
or I'm not going to the Midwest. I'm not even going up the street to Elkton. So yeah.
To Maryland.
Yeah, not probably not happening.
Right,
Probably not
right.
happening. But it's an idea if you do want
Yeah, yeah,
to.
it's good. Listen, it's always good to have an idea to think about. Be like, you know
Yeah.
what? I
Just
just
in
might.
case. Just in case I get ambitious one day and
Right.
wanna,
Be
I
like,
don't know, go work in Columbia, Maryland.
listen, you talking about working in Columbia, America. I've been seeing these ads pop up on my social
Uh-huh.
about Dubai, nursing in Dubai.
Okay.
I was like, oh,
That could
really?
be a thing. I see if I go over there,
Really?
I'm not going to nurse. I'll be trying to find men or something. I'm gonna be doing everything but nursing. I'm not
Nursing
taking
in
my license over there.
Dubai and the other one was Canada.
Again, I
And they
probably wouldn't work too hard. I would be up there doing extra stuff. I'd be all at carnival.
Toronto is beautiful, y'all. If y'all have
Yeah.
never been, it is
I've
beautiful.
never been. It's on my list.
Go.
I
We
want
gotta
to do
go.
wait, they do carnival in Toronto. Yeah, I want to do that.
Mhm. And
I
they
want,
do it well.
yeah, that's on one of my purchase.
They do it very well.
So yeah, I wouldn't be nursing up there. I'll be up there
Be up there cutting up.
partying. They'll send me right back. They'll be like,
They be like,
y'all
she not even working. Like
at all.
be like, we
Please.
revoke your work
I
visa. Go on
left the
back.
license at home. I'm not bringing this stuff.
But listen now, not me over there trying, not me going clicking on the thing and really trying to look up the job. Like, oh, let me see what this pay convert over to. Oh, that's what y'all pay. I might get my work
You
visa.
right. You right. It could be. I know mentally right now I wouldn't be. I would. Mm-mm. That would send me right on
Be
back. I
over there
wouldn't
cutting up.
be able to get another one.
They would have your face plastered on the thing.
They're
Make sure
like,
she
she
don't get
cannot
one.
work visa.
She is not allowed.
Yeah, not allowed. I'd be like, that's crazy. I would tell y'all about it, but maybe later on down the road, not right now.
Be like, she is not allowed to have one. Picture for come up, be like with the little red signal and the alarm. They were like,
Yeah,
ma'am,
I
now
would
you know you
absolutely,
was kicked out. You was
yeah,
kicked out last year.
absolutely abuse that privilege. It would be very minimal work. Yeah.
Oh my goodness.
Yes. So
So
yes,
what else do you have? Do we have
let's see.
anything else?
I think we touched everything. Except for
Okay.
what's going on in the outside world.
All right. So we are going to have rounds.
Yes, let's go to rounds. Ding, ding,
Yay.
ding.
So in rounds, all right, where do we start? It has been so much. I've tried to pull information where I could really go to a source versus utilizing social media, right?
Yes.
Um, so I don't know if everyone has heard about this nurse in Virginia
Mm-hmm.
that worked at I think it's pronounced Henrico Doctors Hospital located in Richmond, Virginia.
Mm-hmm.
So this nurse has been charged with abuse of infants. Um and she basically what happened was she has it's alleged, so because she,
Mm-hmm.
she has to go to court and, be found guilty. But
Correct.
allegedly she broke um these babies, different parts of their body parts. So whether
Mm-hmm.
it's their leg, their arm, um, she hurt them.
Right.
Um, and how can I put this? She intentionally, I'll just say it like
Mm-hmm.
that. She intentionally hurt these infants. And yes, the infants were black babies. They all were
Mm-hmm.
black babies. Um, 7 potential abuse cases at this hospital. It was in the NICU. So if you know anything about the NICU, you know these babies are in there fighting for their lives.
Mm-hmm.
And they need all the extra love, attention, and care. This is where, not to say all newborns don't need that, but these babies, they
Really.
need the TLC.
Yes.
They really need the TLC. And I took the time to really read through the story.
Mm-hmm.
And they talked to one couple. This was their first child. First, I should say, set they had a set of twins. So these were their
Okay.
first kids, because they
Mm-hmm.
were having two at the same time,
Right. Right.
fraternal twins. And it was a difficult pregnancy.
Mm-hmm.
Unfortunately, black moms, we have a high mortality rate,
Mm-hmm.
unfortunately, being pregnant.
Right.
And um they were new parents. They did not know, they did not understand. Um and they weren't sure that if one of the twins were going to live. And
Mm-hmm.
it's unfortunate that that particular twin, his first experience, the one that they did not know was going to, be, with them or not.
Mm-hmm.
um the dad was like, he, went to see him, and they were saying, oh, he noticed, the bruising and stuff. It's like, oh, he broke his leg. And they was it give they said he broke his leg giving a shot, getting his shot.
Mm-hmm.
That's how the fracture happened. And
Okay.
so the dad said that he, was nervous. He didn't want to be blamed for, her harming his child. So he declined to hold his baby.
That's sad.
He declined to hold this baby. And what's even more sad is that um this w- it's sad because the first experience
Mm-hmm.
that this baby had was pain.
Mm-hmm.
That's what this baby experienced.
Mm-hmm.
That was his first feeling of,
Right.
being in this world, was knowing pain
Mm-hmm.
and having, his leg broken by someone that
That's supposed to
took
take
the
care of.
oath of
Right.
non-maleficence.
Mm-hmm.
And if you're a nurse, and I know this is going way, going back
Right.
to school, but we take ethical there we they teach us ethical principles. So you got
Mm-hmm.
justice, you got ferocity, which is telling the truth. You got
Right.
beneficence, promoting wellness. And basically when you look down all these, all those ethical principles,
Mm-hmm.
I want to say it's about 7 of them that they teach us. She broke all of them because, autonomy
Mm-hmm.
is, allowing the patient to make their own decision. She
Right.
broke all of them except for autonomy.
Mm-hmm. Yep.
And because, the child can't really make their own decision, they can't even speak for themselves. We're
Right.
supposed to
But they
protect
wouldn't
them.
decide that.
Right.
So she wrote that one too.
Exactly.
It's all
And
of it. It's crazy.
so it is, so she is charged with maliciously wounding, um, and felony child abuse. She was charged in November 2024. Um, and like I said, they are going through, they're combing through uh all of the hospital, the investigators are coming through all of the hospital's
Hmm.
camera footage because they said there may be more
Hmm.
victims.
I'm sure it is.
I don't doubt it. I don't
Yeah,
doubt it.
I'm
It's
sure it's
sad that
probably a lot.
it went on this long.
Hmm.
It went on this long. And this story actually came to light this month.
Hmm.
Um, and so apparently it had been going on for a year or more. And
Hmm.
it's really sad. In the hospital, they're not accepting any babies in their NICU
Hmm.
at this time. So, I read she was in court crying, talking about she has a lot of regret.
No,
I
she
think I would think her regret is getting caught
absolutely,
because you've done it to seven, allegedly.
allegedly.
They only charge her with one child.
Hmm.
So allegedly you have done this several times.
Hmm.
n- to
Yeah,
black
to black
infants
babies.
in the NICU.
To hurt a baby anyway, you're already a terrible individual.
Exactly.
Like it just in general, nursing or not, if you would harm a child, an infant, and like you said, an infant that's fighting for their life, you are a sick individual in
To,
general.
to look at an infant and be like, you know what, I'm gonna break your bones today.
Hmm. It's crazy.
What
That's a crazy
what
thought.
right? Exactly. I'm like, where does your mind have to be to think
Yeah,
that?
yeah.
It's sad. In my opinion, I think it's sinister.
Yes.
Why would what would make you what would have your thought process that distorted to
Hmm.
look at an infant,
An infant.
in NICU
Hmm.
that's fighting, that's hooked up to all these little things, and all anybody want to do is like hold them, love them, and make
Make sure
sure
they're
nurture
okay.
them, and make sure
Right.
that you can get them where they need to be so they can go live a prosperous life with their
Hmm.
families, right?
Yep.
And to think that there's this individual out there that does not see that when they
Hmm.
look at black infants.
Hmm. It's
It's hurtful. It's disheartening.
hmm it's very disheartening. And they she needs everything that she needs.
Oh yeah.
Everything.
They definitely need to, yeah,
Mhm. Yeah.
no parole, locked up with no parole for
Yeah.
sure.
And the
For
hospital
sure.
definitely needs to be looked at as well.
Well, apparently there was an investigation, because, oh, and the part that I'm leaving out. So this particular family, the twins, their
Hmm.
family, the grandmom was a director of nursing at another I think it is another hospital or at some clinic
Hmm.
in Virginia. And they told her what happened,
Hmm.
and she took the time to educate them and say, there's no way that that could happen. This is
Right.
how you administer a shot to an infant,
Hmm.
and there's no way that can happen. And
Hmm.
so the grandmom called Child Protective Services. There was
Good.
an investigation, but apparently at that time, it was closed because they couldn't find anything.
Right.
Well, lo and behold, came back around,
Hmm.
and here we are,
Right.
or here they are.
Here they are. Right. And that's why I said the hospital, all of them, because if a baby has a fracture in the NICU, I think
More
everybody's
than and not
more
just one,
right.
not
It's
just
it's
one now.
happening multiple times.
Times.
You're coming onto your shift, and this baby who's been laying there on the machines has a broken arm. We need to everybody. That's everybody's part. Are were they reporting that? to the next
Right.
shift, to the next nurse. So everybody has a, I mean, I feel like to a certain degree, everybody has a hand in that. Once you come on and you're taking the shift and like we're okay with this baby having a fracture,
Right.
the director didn't say, even if they didn't think anything was foul at the time, but you got a couple babies and they're all having fractures from shots or whatever the case may be. Nobody did, like, where was the re-education? What did y'all try to do
That
to
part.
make sure
What was
that
the
this wasn't
quality
happening again?
improvement
Right.
to rectify the area,
Mm-hmm.
um, where it was, like you said, where it was lacking?
Right. Right. Because again, she was 100, like, she was sick. She is sick.
Right.
So I'm not saying that their responsibility is what she did. She was, that's a whole different thing. But when you're coming on and you're receiving a report or you're noticing
Right.
that your infant that you're watching is in pain or something is going on, like, I would want to know what the follow-up was from that. Like, how did it go on? Like you said, how did it go on? So a year,
Yeah.
7 babies in a controlled environment is having broken and fractured. Like,
Yeah.
nobody thought all of them are black.
Right. And this is the thing, if you've ever been on like the a unit where the maternity unit or even the NICU unit, it is locked
Mhm.
down tight. You
Locked
gotta
down.
you gotta go
Yes.
through a lot to get on there.
Yes.
They just not letting you just can't walk all through there. They're not
Correct.
letting anybody through there. So I don't understand. I don't know if they didn't look through the footage. It's not for me to say or
Right.
whatnot, but
It seems like a lot of
yeah.
open holes
Yeah,
to me.
it does.
Yeah.
Absolutely,
Even like
absolutely.
on one-on-one, like your license is on the line anytime you walk into, whatever job you have. I go to
Yeah,
work, whatever is happening, if I'm doing meds, whatever, that's my license. So I want to make sure everything is straight. So I wouldn't even feel comfortable. I never worked in an ICU or NICU, but just the
right.
thought of the intensity of the environment, I wouldn't even feel comfortable coming onto a shift taking on a patient with, maybe the
Mm.
first time I'd be like, all right, let's try to see. But the second time, hold on.
Another one?
Why I'm getting all these babies with broken bones? Like,
Right.
my thought process, me as a nurse, I would be like, now hold on, because at some point, something is
Where,
gonna come back.
where's the GUAPI committee? That's
Yeah,
the quality improvement. Those the
yeah,
folks that should have been like speaking up in them meetings, and then the quality meetings like, hey, what is going on here?
hmm yeah. What
Or
happened,
was it not being reported? It's so
or
many,
was
like you
it right?
said, it's
Right.
so
I
many
hope they
open
give more
holes.
information about
Like the
that because,
patient safety, like that goes hand in hand with the GUAPI committee. So
hmm
like it's crazy. It's like you said, it's so many holes, it's so many like where was the re-education? Where was the rectification for
right.
patient safety, the
If
error?
they thought that's what it was.
Right, right. But s- some alarms should have started ringing
Hmm
when, okay, how did this happen? It was in
Right.
the NICU of somebody baby, and you know how people are about their babies.
Yeah, yeah. That's why I'm like, I'm
Yeah, I don't care
surprised.
if it's they first one, they second one, third,
Hmm
fourth, fifth, or sixth. You
Right,
talking about my baby got a broken what?
right.
Broken anything? Yeah, you call
hmm
somebody gonna somebody gonna be ready to squabble up.
Yeah, absolutely. That's why I'm
So
surprised. And
you
that's why I
can't,
say I would
yeah,
definitely like to hear more about this case and the follow up because,
absolutely.
yeah, no, I'll leave it at that.
Yeah, I will definitely be keeping track of it because I'm interested in learning, finding out what happens. Will they charge her with with the remaining six?
hmm
Will they find more?
hmm
As they're, looking through the hospital footage for, in this area.
Right.
So I'll definitely,
hmm
spin the block and give y'all an update
Yes. Yes.
for sure. You got anything for rounds?
Y'all just know that's enough. That's enough.
That's enough. Well, just For CDC said that they have been seeing an uptick in respiratory
Oh,
illnesses
yes. Everybody.
around the US, everybody. So
Yeah.
please make sure you are hand washing because they got the norovirus as well. So make sure you're hand washing, make sure you're wearing your mask. I don't care if people looking at you crazy. What you want to be sick or you want to get crazy looks with the mask on.
Right.
Me, I prefer to have the crazy looks with the mask. I do not enjoy being sick. I don't want to have to be on medication if I don't have to. I got too much going on. So I'd
Right.
rather just have the crazy looks and not be sick going out here sneezing, coughing.
Yeah, because it
And
is the season.
it is the season. Keep
Yeah.
them germs to yourselves. Um, next, last but least, arm rounds. This is for I would say this is also for like our director of nurses for clinics that have to oversee clinics with providers,
Hmm.
and also for our providers. So whether you are NP, PA, doctor, whatever the case may be, if you are a LPN or RN that work with a provider, this is some information that was posted on the DEA.gov. It's in regards to um, telemedicine rules
Hmm.
that continue to open access to telehealth treatment while protecting patients. So, what the DEA, they made three announcements this week. So what they are doing is they have implemented where the patient has to see a provider in person, have at least one in-person visit with a medical provider if they've never seen that medical provider before,
Okay.
um, so that provider can prescribe any medication they need through telehealth indefinitely.
Okay.
So one in-person visit with your provider, especially if it's a new provider. Any provider
Hmm.
is going to want to see you in person. And
Right.
then after that, subsequent visits, whatever the case may be, whatever is going on, they can be all telehealth
Right.
and
Which
they
is
can
good.
prescribe whatever medication you need.
Yes.
Um, they're also working on a nationwide prescription drug monitoring program.
Okay. That's
Who
actually good.
knew? I said, okay,
That is good.
that is
That's
very
going to cut
good.
down a lot.
A whole lot, a whole lot. And so I thought that was great.
Yeah, that is good.
Hearing that. Uh and for those of you that may not know, if you are a new grad nurse or whatever the case may be, the prescription drug monitoring program, usually each state has their own, and
Mhm.
a lot of times your provider will give you access, especially if you are their nurse assigned to help them or whatnot. Or if you are the director of a clinic, sometimes you may have that information. You can go and check for the provider on a particular patient
Mhm.
if there's something questionable. You got some questions, you can go and see if that patient has been prescribed certain, medications,
Right.
like schedule uh 3, 4, or
Mhm.
whatnot. So next, they're also doing a special registration for telehealth and limited state telemedicine registrations. So what they're trying to do here, with this one is make it where um, they can basically go through and and have a in-person medical evaluation from a medical provider,
Okay.
um, and via, telemedicine, and they can get the medications they need. So these providers may want to prescribe Schedule 3s, 4, 5 controlled substances.
Mhm.
Um, they will be able to do that.
Okay.
But definitely come on here, read more. They have the links for you to click on and can walk you through what you need to do, um, for all of that. And last but not
Right.
least, they are expansion of buprenorphine treatment via telemedicine encounter.
Okay.
So, if you're not familiar with buprenorphine, buprenorphine is administered for opioid use disorder.
Mhm.
This allows patients to receive 6 months supply of buprenorphine through a telephone consultation with a
Okay.
provider.
That's good.
Yep.
That's good. Okay. So definitely some progress, some new things coming on. So that's good. That's gonna look if is when everything is in this flow, those are all good things that will help.
Now, and we do have a new incoming administration, so
Yes.
hopefully all of this can, stay.
On
But
the up and up.
yeah, but I don't know. It may decide to take it away. I don't know why it would. It's helpful.
Hmm.
It's definitely removing barriers to access to care.
Right.
So I think this is great information. Again, good. You can go read it for yourself, and like I said, you can click on these links. It's www.dea.gov, and
Okay.
you can go there.
Hmm.
So that's my spiel
All right. I'm
around.
with it. I have nothing else to add. That was I was done after the babies. So
Right, right. Listen, that that was enough, but I had to kind of bring it back because yeah, yeah,
yeah. Absolutely.
that was enough for
Absolutely.
me. All right.
Okay, so yes, well, that ends episode 4, but our first episode of 2025. We
Yes.
look forward to connecting with you guys again. Add us on YouTube, Instagram as well.
Yes. Yes.
I don't even know. I said, and I now don't remember. It's if you follow me, it's its Jessica Renee, um, and then you can keep. I know I tagged you, so you can keep
Yes, she
up with
tags me.
clips
So, yep.
and follow us over there and just kind of stay in the mix where we can actually talk and communicate. We'll see what happens with TikTok.
Yeah,
We'll go from there,
yeah, a
but
lot of
definitely you can find
mine.
us on Instagram and YouTube.
Yeah, you can definitely find us on YouTube. My Instagram is Calm Couture Wellness. So uh that's where I'll be at.
Yeah.
On Instagram. However, not very active on Instagram. Definitely was more so active on TikTok. But in the wake of the TikTok ban, I know we'll primarily be on YouTube and
Yes.
Instagram for sure.
Yes. So leave us some comments. We want to talk to y'all. Let us know what you like, what you
Yeah,
don't
yeah.
like. Yeah. Find us on somewhere.
Let us know. Listen, definitely drop some comments. Let us know what your goals are for the year that
Yes.
pertains to you. Okay,
Yes.
that pertains to you and what you plan on doing in your career to better yourself and move forward. We want to hear what they are. We want to hear from you. And again, if you're interested in coming on the show, definitely hit us up. We would
Yes,
love to have you.
absolutely. Absolutely. So yes, I think that's good. Should we like talk about what our topic could possibly be for February?
I mean, you can.
We did do our planning and setting goals. So we do have a little bit of stuff going on.
Yeah. Oh, listen, we got so much going on. But yeah, give them a
Yes.
little teaser
Yes.
before we go.
So if you've been following us, we at least give at least one topic a month. So this month, of course, is New Year, New Nurse. We had our guest last month, Cherry. I can't even think of her. Chronically
You're
Fabulous. I was about to
fabulous.
say her full name, but
Aliases.
we had Chronically Fabulous on for December, and so February, of course, it's the month of love. We are, and if you haven't guessed, I'm the lover girl. We're going to talk about love. I'm so excited. But in the nursing field, we're going to make sure you're prepared sexually. Make sure there's no STDs, nothing like that. So bring your question, drop your questions. Maybe we can
Yes.
do that. Drop some questions, some emails, messages that you may have you want us to talk about around concerning love, sexual health, STDs, all of the things that come with February. It's gonna be a great
Yeah,
episode.
it's
I'm
gonna be a
excited.
great episode though. It really is. We are gonna talk about some everything.
We're gonna
For the month of
get
February, we're gonna make sure y'all stay safe.
yeah, that's it. Stay safe.
And how to information you could definitely pass on to your patients to make sure that they remain safe as well.
Yes, absolutely. So yeah, so enjoy this episode and then meet us back in February.
All right.
All right. Talk to
Bye.
you later.